Hi, you're probably watching this because you've injured your wrist. I'm a hand and wrist surgeon and I'd like to tell you something really important about wrist injuries. Of the many small bones in the wrist, the most commonly broken, or fractured, is the scaphoid bone, shown by the arrow. Scaphoid fractures are common in young men and typically occur when falling on the hand, or when the wrist is bent back too much. These fractures are often just a crack, so very difficult to see on an X-ray. If the wrist is put in plaster, almost all of these cracks will heal in around 6 weeks. However, if the fracture isn't spotted on the X-ray, patients are sometimes told it's a sprain and they don't need a plaster. A scaphoid fracture will then not heal. This is called a non-union. The problem with the scaphoid is that sometimes a non-union is not painful and people don't know they have a fracture until much later, perhaps when they have another injury. A non-union can be treated with surgery, but this doesn't always work and the recovery takes months. If the non-union isn't treated, the wrist eventually develops arthritis, pain, swelling and stiffness. Arthritis is more difficult to treat than a scaphoid non-union and may need complex surgery to remove the whole scaphoid. Once arthritis is developed, the wrist is never the same and is usually stiff and painful. Unfortunately, hand surgeons see a few patients like this every year. It's really sad to see young sports people and manual workers suffer with this problem when it could easily have been treated in a plaster. I made this video to try and help prevent this happening. So, what can you do if you have a wrist injury? Well, firstly, don't worry if you just knock your wrist against something. Scaphoid fractures are usually caused by a heavy fall, but 1 in 3 are caused by the wrist being bent right back, punching, or another significant force to the wrist. If you have wrist pain after this sort of injury, you should go to your emergency department or minor injuries unit to get it checked. When you are seen, ask the doctor or nurse, could I have a scaphoid fracture? If they think you could, then you should have an X-ray with at least 4 different views to see the scaphoid properly. If you're told it's a sprain, but you still have pain after 2 weeks, wear a wrist splint and seek medical advice again. You may still have a fracture. X-rays can only reliably rule out a scaphoid fracture 6 weeks after an injury. Until this time, an MRI scan is the best way to see if there is a fracture. Remember, scaphoid fractures may be difficult to see on an X-ray, especially without special views. They may not cause much pain and are often thought to be a sprain. Most scaphoid fractures heal by protecting the wrist in a plaster. Without this, they usually need surgery. Hopefully, after watching this video, you won't be one of the unlucky few whose fracture is missed and you have to have surgery. Thanks for watching. If you found this useful, please like or share it.